Every day, billions of people take medicine, trusting it to heal them. But what if, hidden inside every pill, every capsule, every syrup, there was something that didn't belong? Something invisible, something accumulating, something called microplastics. Today, we uncover a thread hiding in plain sight, inside the very medications meant to protect us.
So, what are microplastics? Microplastics are tiny plastic fragments smaller than 5 millimeters. Some so small they're invisible to the naked eye. They come from the breakdown of larger plastics, from synthetic fibers, and from industrial processes. They have been found everywhere, in our oceans, in our drinking water, and even in the air we breathe. And now, researchers are finding them in our medicines. So how do microplastics end up in the pharmaceutical products? The answer lies in how drugs are manufactured and packaged.
Plastic is everywhere in drug manufacturing. Let's trace the steps. Step 1. Drug ingredients are mixed in plastic-lined tanks and moved through plastic pipes. Step 2. The mixture is shaped into tablets using plastic molds or coating drums. Step 3. Tablets are packed into blister packs. Those pushed through plastic sheets or plastic bottles. Step 4. Even IV bags, syringes, and tubing are made of plastic. At every step, friction, heat, and pressure cause tiny plastic fragments to break off. These fragments fall directly into the drug. But there's another source most people don't know about. Some drug coatings and capsule shells are made from plastic-based inactive ingredients. That means you swallow plastic on purpose as part of the medicine itself. According to Alzani and colleagues in their 2023 study, published in the Journal of Environmental Health, microplastics get into food and drugs through industrial factory processes, and this has a direct effect on human health. Unlike food or water, where we have some choice, medicine is different. When you take medicine, it is meant to go into your blood. That makes plastic contamination especially dangerous.
Let's take a closer look at packaging, one of the biggest sources of microplastics. Most pills come in blister packs. When you push a tablet through the foil, friction rubs off microplastics from the edges. Those tiny pieces stick to the pill, and you swallow them. Liquid medicine in plastic bottles have a different problem. Over time, chemicals from the plastic move into the liquid. Some of these are microplastic fragments. Others are molecules that turn into particles inside your body. Even single-use plastic syringes and IV tubing shed particles during use. That means hospitalized patients can get microplastic injected directly into their veins over and over again.
But what happens when microplastics get inside us? Many people think they just pass through, in one end and out the other. But research shows something different. Very tiny microplastics, smaller than 1/10 the width of human hair, can cross from your gut to your bloodstream. From there, they travel to your liver, kidneys, lungs, and even your brain. When stuck in your tissues, your body sees these plastic pieces as invaders. It attacks them. That causes inflammation, swelling, and irritation inside your body. Over months and years, chronic inflammation can lead to serious diseases, such as arthritis, heart disease, and even cancer. Microplastics also cause oxidative stress, a kind of internal rusting that damages your cells. But the plastic pieces themselves are only half the problem. They carry chemical additives, things like phthalates, BPA, and flame retardants. These chemicals are not locked into the plastic. They leak out inside your body. Many of these chemicals are endocrine disruptors. They mess with your hormones. That can affect growth, reproduction, metabolism, and brain function. Again, according to Alzani and colleagues from their 2023 paper, Microplastics in drugs can cause inflammation, cell damage, and hormone disruption in the human body. For a healthy person, this is worrying. But for someone already sick with cancer, diabetes, or organ failure, microplastics add one more burden to the body. And that's not fair.
The problem doesn't stop with the patient. Drug factories create huge amount of plastic waste from old packaging, rejected batches, the water used to wash equipment. When this waste is burned, it releases toxic smoke. When it's buried in landfills, it breaks down over hundreds of years into microplastics that seep into groundwater. And too often, it ends up directly in rivers and oceans. According to Coleman and his team, in their 2019 study in the journal Water Research, microplastics spread through fresh water and drinking water system. They found that most water treatment plants only catch some microplastics. The rest pass through into our taps and rivers and lakes. Here's where it gets even worse. According to Zhu and colleagues in their 2023 study in the journal Science, The Total Environment, microplastics in water act like magnets for leftover drug residue, antibiotics, hormones, chemotherapy drugs that also come from factories or human waste. The microplastic carry these drugs over long distances. This changes how the drug act in the environment, how toxic they are, how long they last, and how easily animals eat them. Fish and shellfish eat these contaminated particles. The drug enters the food chain and eventually comes back to us on our dinner plates. From the factory floor to the ocean floor, microplastic pollution from medicine leaves a trail we haven't learned how to stop.
With all these risks, you might think there are strict rules about microplastics in medicine. The truth is more disappointing. Right now, there are no global limits on microplastic contamination in finished drugs. Why? Because testing is very hard. Particles are tiny, come in many shapes, and are easily confused with dust. Some agencies require drug companies to test for visible particles, but microplastics are invisible. The European Medicines Agency has advice about plastic additives in packaging, but not about microplastics breaking off. The US FDA has no specific limit for microplastics in oral drugs. A few countries, Germany and Japan, have started watching programs, but most drug companies are not required to check for microplastics or report what they find. Meanwhile, the drug industry has been slow to look for alternatives. Plastic is cheap, clean, and works well. There's not much pressure to change.
The good news? Scientists and some forward-thinking companies aren't waiting for rules. Solutions are coming from three directions. First, bio-based plastics. These are made from plants instead of oil. Think corn, sugarcane, potato waste, and even algae. These materials can replace regular plastic in drug packaging. The best ones breaks down naturally into water, CO2, and plant matter, leaving no microplastics behind. According to Ferreira Felipe and colleagues, in their 2021 review in the journal Sustainable Materials and Technologies, plant-based plastics can be good alternatives to regular plastics. However, they also warn that not every plant-based plastics is biodegradable. Some last just as long as regular plastics, so we need to choose carefully. Second, biodegradable drug coatings. These are special plastics that break down inside your body into harmless natural substances. Doctors already use these for surgical stitches and implants. Now, scientists are using them for pills and capsules. According to Wang and colleagues in their 2025 study in the journal Materials, biodegradable plastics works just as well as regular plastics for drug delivery. They found that these biodegradable polymers can deliver medicine effectively without leaving permanent plastic pieces inside your tissues. Third, stronger rules experts are calling for. required microplastic testing for all plastic drug materials. Legal limits on how many microplastics are allowed, just like limits for lead or mercury. Rewards for companies that switch to biodegradable options. Cleaner factory systems that catch plastic waste before it escapes. Few companies are already doing this, using glass or aluminum packaging, installing particle detectors, and working with bioplastic makers. But without wider rules, these companies are the exception, not the rule.
You might be thinking, this is a factory problem. What can I, as one person, possibly do? More than you think. There are 4 things you can do to take action. Number 1, ask questions. When you pick a medicine, ask your pharmacist, does this company test for microplastics? Is there a version in glass packaging instead of plastic? Number 2, dispose of medicine correctly. Never flush or throw drugs in the trash. They end up in water anyway. Use drug take-back programs or pharmacy drop-off boxes. Number 3, talk about it. The more people know about microplastics in medicine, the harder it is for companies and governments to ignore it. Number 4, support change. Look for organizations working on plastic pollution and drug safety. Your voice and your support matter.
Microplastics in medicines are not a future problem. They are here, right now, in our medicine cabinets, in our water, and in our bodies. Every pill you take might carry an invisible passenger, a piece of plastic that doesn't belong there. For most people, one pill is not a big deal. But we take medicines for days, months, and sometimes years. Little bits add up. It matters even more for children, for the elderly, for people who are already sick. And here's the hopeful part. Solutions exist. Plant-based plastics, biodegradable coatings, better rules, cleaner factories. But change has to be slow. The drug industry is huge. It moves only when pushed by science, by laws, and by people like you who care. Awareness is the first step. The more patients, professionals, and policymakers understand this problem, the faster we will see change. What goes into our medicine matters. What comes out of our factory matters. The health of people and of our planet depends on getting this right.